After several attempts to push stopgap funding through Congress, the sticking point is the partisan conflict over how much the government should help those relying on Affordable Care Act subsidies. Lane County Public Health explains the impacts cuts to the subsidies will have on residents.
A partisan pause on a stopgap bill, funds that would continue government funding already approved by Congress, as Republicans call for a cut to Affordable Care Act subsidies. If the ACA funding is cut, those on ACA exchanges will see an uptick in cost in 2026. The subsidies go to some 23 million people and they expire at the end of the year, but Congress can choose to extend them at the cost of about $350 billion over 10 years. Lane County Public Health says several thousand people in the county take advantage of the subsidies.
It's their way to get health care. And without it, they might not have health care.
Ledke says while full-time workers in the county are more inclined to be covered by their employer, part-time, temporary, and probationary workers who don't qualify for Medicaid often rely on the subsidies. Oregon's U.S. Senator Jeff Merkley held a Zoom conference Wednesday discussing the impacts.
Those folks buying on the exchange are facing the most recent national estimate was an average of 75% increase in the cost of their premiums. For Oregon, the projected increase is 68% increase. So we're not talking about 2% inflation, 3%, no, 68% inflation or $1,300 per person, with some families having to pay as much as $8,000 to $25,000 more.
Republicans say Democrats want to give immigrants in the U.S. illegally free health care, while Democrats blasted Republicans for creating more financial burdens for American citizens under the guise of the subsidies being used on illegal immigrants. Congresswoman Val Hoyle said in an interview Wednesday that she hopes the Senate will be more reasonable than House Speaker Mike Johnson and his leadership team, which refused to negotiate, saying they did not need Democratic votes.
People who rely on the Affordable Care Act for coverage are facing skyrocketing costs, and we're ready to negotiate a bipartisan solution to reopen the government. Undocumented immigrants are already prohibited from getting these tax credits. So we're fighting to extend tax credits for legal citizens. We want to make sure that coverage stays affordable for working families.
Ledke says there is a cost to extending the subsidies, and an extension is one of the cheapest.
We have very good data to show that people who are insured are healthier. People who have a full-time job are healthier. So getting people insured is very important with health insurance. That means they have access to care, they know where to go, and they're not scared to go because they might have a bill they can't afford. If these subsidies don't go through, or some other way to get health care to people, people will ignore their health care, their health needs, until they have to go to the emergency department.
Republicans claim Democrats are making radical demands and want health care subsidies for people in the country illegally, something Democrats say is patently false.